Fragile X syndrome by Jaden Mutsauce. Some alternative names of Fragile X syndrome are X syndrome, Martin-Bell syndrome, and Fragile X. Fragile X syndrome is caused by the lengthening or expanding of one side of the X chromosome. This is called a gene mutation. Fragile X syndrome is caused by a changed mutation in the FMR1 gene and is inherited in an X-linked dominant manner. The name Fragile X syndrome was chosen because when one side of the X chromosome lengthens, it makes the X chromosome very fragile and it can cause many defects and other things. In 1943, James Purdon Martin discovered a form of sex-linked mental retardation that is inherited from the X chromosome of a mother carrying the trait or an affected father. The syndrome was initially named Martin-Bell syndrome after its discoveries, but the name was changed to Fragile X syndrome. Fragile X syndrome is a genetic condition that causes a range of developmental problems. It is a developmental disorder, and it can include learning disabilities and cognitive impairment. Usually males are more severely affected by this disorder than females. Affected individuals usually have delayed development of speech and language by the age of 2. This is a graphic of X-linked inheritance and Fragile X syndrome. As you can see, there is a carrier mother with double X chromosomes and a unaffected father with an X and Y chromosome. The carrier mother has one carried X chromosome, and she could give it to one of her offsprings to make that offspring affected. As you can see, the son is affected in this graphic, while the carrier mother could also have an offspring that could be another carrier, which is the daughter, but also both parents could have 2 unaffected children. So, as you can see, Fragile X syndrome is an X-linked inheritance. There are many symptoms of Fragile X syndrome. Some of these are intellectual disabilities, ranging from mild to severe, attention defects and hyperactivity, especially in young children, anxiety and unstable moods, autistic behaviors, such as hand flapping and not being able to make eye contact with others, sensory integration problems such as hypersensitivity to loud noises or bright lights, speech delay with expressive language more severely affected than receptive language, seizures such as epilepsy affect about 25% of people with Fragile X syndrome. There are also many physical symptoms and signs of Fragile X syndrome. Some of these are having a long face or large prominent ears, flat feet, hyperextensible joints, especially in your fingers, low muscle tone, and males may have large testes after puberty. There are very few ways to diagnose Fragile X syndrome, but the main way is doctors will just look at the physical features of a child to see if the child has a abnormally large head and circumference or has different facial characteristics than normal children. If a doctor believes that a child does in fact have Fragile X syndrome, a specific genetic test called PCR, polymerase chain reaction, cannot be performed to diagnose Fragile X syndrome. This test looks for expanded mutation called triple repeat in the FMR1 gene. There is no average life expectancy for someone with Fragile X syndrome. It is actually about the same as an average normal human being's life expectancy. There is no specific treatment also available for Fragile X syndrome. Supportive therapy for children who have Fragile X syndrome includes special education, medication to manage behavioral issues, although no specific medication has been shown to be beneficial. Early interventions, special education, and vocational training could be needed. Some problems are vision, hearing, connective tissue problems, and heart problems, which, when present, are treated in the usual manner. Also, you could end up being epileptic if you have this disease. It is hard on family members if your child does have Fragile X syndrome. There are routine doctor's visits that your child must go to. You also probably have to put your child through special education and many other therapy sessions to gain those social skills for your child. There are many advancements in Fragile X syndrome, with researchers helping to figure out how to fix this disease. Michigan Health Lab is one of these researchers that are working very hard to get to the bottom of this disease. Researchers are making initial strides toward the treatment of the genetic mutation Fragile X syndrome. The Michigan Health Lab is working on being able to edit DNA, so Fragile X syndrome isn't even a possibility anymore. But this is a large controversial topic, and people do not know how to feel about the way of editing DNA. Michigan University has tested this, and they have used a special activator protein to specifically get into the FMR1 gene and stop the repeat of this genetic disorder. Here's another graphic, and this shows the first person in each family of someone that has Fragile X syndrome that is concerned with the behavior or development of their child. It shows that 73% of first person to be concerned is the parent. Then next it goes a health professional, and then next another family member. But it just shows how wide of the spectrum is that parents notice something wrong with their child. Now here is a short video of a family that went through trouble just trying to diagnose their children with Fragile X syndrome.
Fragile X syndrome, and I just wanted to give you a little insight about our life. We didn't know what was wrong with them in the beginning. I was 8 months pregnant, and my 2-year-old was showing signs that weren't good. People thought he was autistic, but I knew there was more to it. And then I had a baby who seemed really normal and typical and awesome. And by the time they were 2 and 4, I finally, after going to 1 million doctors and spending a lot of money in Ventura County, Conejo Valley, and the San Fernando Valley, I finally went to Beverly Hills to a specialist and got a diagnosis. We went to Children's Hospital, and it was just a blood test. And that was pretty funny because we went to a really good neurologist in